Hi, my name is Liv Sasaki, and I am the Executive Director of the American Heart Association here in Utah. I am here with Dr. Lana McGill, and we're talking about women's heart health and the importance of knowing your numbers. Thanks for being here.
Thanks for having me.
Absolutely. So we know that healthcare can sometimes be overwhelming, and women juggle a whole lot in their lives. Can you tell us a little bit about where women should start when they think about their health and well-being?
We're really good at getting our kids to the pediatrician, making sure our parents have their medications and their refills, but sometimes it's easy for us to let our own health slide to the back burner, and really that's a disservice to ourselves. It's important that we as women prioritize our own health for the longevity and the quality of life long term. And there's a lot of things that we can do to kind of help prevent the development of cardiovascular disease.
So when we think about giving women a place to start and partnering with a healthcare provider, what's most important for them to find someone?
Yeah, great question, because it can absolutely be overwhelming on where do I even start. So most women are very good at prioritizing reproductive health throughout their life. So they've got a great partnership with an OB who's helped them navigate, potentially having children or not. But it's also important to have a primary care provider to help evaluate your risk for heart disease and stroke, because those can be really devastating illnesses if they're not identified and treated early on. So really having some basic screening obtained, sometimes it can be done through an OB team, but oftentimes having a primary care provider partner with you in your journey over the long course of your health is best. And they can help screen for elevated blood pressure, high cholesterol, diabetes, and all of those are diseases that we can control with lifestyle interventions as well as medications. And so having a partner that you can turn to help guide those diseases, to monitor for them or treat them if and when they develop, is really, really important.
And knowing your numbers on those things is important for cardiovascular health. Can we talk a little bit about blood pressure?
Yes, absolutely. And, I'll kind of talk through some basic numbers of what are generally accepted as normal values, but, kind of based on your medical condition and where you are in your life, your specific numbers might be a little bit different. But generally speaking, we want to target a blood pressure of less than 120, which is that top number we call systolic blood pressure, over 80, which is the diastolic, or that bottom number. And that kind of gives us a range of how our blood pressure is managed over time, and lower tends to be better. We obviously don't want it so low that it's in a dangerous range, but less than 120 over 80 is generally where we want to target.
When a woman goes to their provider, what do they expect when they are being monitored for their blood pressure?
Yes. Sometimes going to the doctor can be a scary thing. And so some people have higher blood pressure measurements when they're actually at their doctor's office compared to at home. So blood pressure is something that can be monitored at home. Sometimes drugstores have monitors, or there's a lot of home monitors that are also available and can be really effective tools at monitoring your blood pressure long term. I think it's important to know when you're going to measure your blood pressure, you want to make sure your feet are flat on the floor, you're sitting in a supportive chair, you're kind of relaxed, so that we can get an accurate measurement of your blood pressure. And monitoring your blood pressure outside of the hospital or outside of your doctor's office can be equally powerful as getting it checked when you're actually with your provider.
And then there's a couple of others when it comes to, heart health that we're thinking about: cholesterol, blood glucose. Can you talk a little bit more about those and the importance of them?
Yep, absolutely. So we monitor for elevated blood glucose and cholesterol through simple blood tests. And so those can be ordered by your primary care provider. And depending on what those results are, you might have a recommendation to recheck in 5 years or in 1 year or in 6 months, kind of depending on what the levels are, what your specific risks are for cardiovascular disease, and any interventions that we might pursue, some of which might be lifestyle. We have a lot of control over what we eat and how active we are, and both of those factors can have dramatic impacts on our blood pressure, our cholesterol, and our blood sugar levels, all of which will be puzzle pieces that, contribute to our long-term health and longevity.
So we want women to know their numbers when it comes to blood pressure, glucose, blood sugar. Maintaining a healthy weight is also important too.
Yes, absolutely.
I love that. That's great. Can you tell us a little bit about if a woman doesn't have a primary care physician, how can she best find one?
Yeah, excellent question. So this comes up a lot because there are a lot of people in our community that don't have a primary care provider. One great place to start is if you do have health insurance, you can connect with your health insurance provider and say, hey, I need a primary care who is in network, and they can help partner you with someone in that network. Additionally, we're really lucky in the state of Utah. There are a lot of primary care services that are available if you don't have health insurance. There's a lot of good resources online for free health care if that's something that you're looking for, or partnering with your insurance to find a primary care provider is a great idea.
That's great, having a place to start.
Yes.
Yeah. And if people are interested in knowing more about, knowing their numbers, where should they go for additional resources?
I have found some wonderful handouts on heart.org, and there are some lovely handouts. You can print them out and put them next to your kids' artwork on your refrigerator, but there's guidance on blood pressure, sleep, exercise, diet, all kinds of things. Wonderful, wonderful one-pagers that you can access.
Thank you, Dr. McGill, for being with us.
You're welcome. Thanks for having me. Appreciate it.